Hey, I'm Sam Liccardo. I am the proud representative of the 16th District in Congress, and we are wrapping up appropriations bills. Why should you care about appropriations bills? Well, because we didn't pass appropriations bills a couple months ago. We had a huge government shutdown. This essentially keeps the government running. These are the spending bills that matter in all the departments. And we're going to see several of these big appropriations bills moving at the same time, so it's very complex and very messy. But I'll just talk about one of those bills today to give you a very clear sense about how the winds are starting to change here in Congress. We've seen Republicans on several controversial votes jump ship. And as a result, we're starting to see Speaker Johnson and the Republican majority leadership back off and be a little more collaborative in working out some of these areas where, frankly, in the past, there was absolutely no collaboration. So on health, for example, we saw President Trump come out with a $33 billion cut to healthcare services. We've already seen horrible cuts in the big, ugly budget a few months ago. We are not seeing those $33 billion in cuts now in the appropriations. That's good news. We're seeing increases in some programs, for example, like community health centers, which serve a lot of underserved communities in districts like ours and throughout the country. We're seeing an extension of telehealth services, which are critical because Medicare and Medicaid have to pay for the telehealth, that is, the care that you receive over Zoom or over the phone, generally much more affordable, better way to get health care for a lot of folks who may be homebound or unable to travel. And we haven't had an extension of Medicare payments for that. We now will get 2 years of telehealth, which is critically important. Finally, PBM reform. PBM stands for Pharmacy Benefit Managers. These are folks who are making huge margins on the distribution of drugs between the manufacturers and the ultimate providers of prescription drugs. As a result of this bill, we'll be mandating price transparency so everyone can see what they're buying at, what they're selling at, and the market will finally drive those costs down so that you're not paying as much as a consumer or as a taxpayer. So this is just health. We've got other bills to talk about. Thanks for joining us.